Hey everybody, this video is very important about daily symptoms which happen for us. Watch video for the end. And don't forget subscribe and share this video to spread benefit. And before diving into the causes of hypertension, it's crucial to understand what this condition entails. So what exactly is hypertension? Hypertension, or high blood pressure, is a condition where the force of the blood against your artery walls is consistently too high. This can lead to severe health complications over time if not managed properly. Now, let's talk about the signs and symptoms. Often, hypertension is asymptomatic, earning it the nickname silent killer. However, some people may experience headaches, shortness of breath, or nosebleeds, though these symptoms are not specific and typically don't occur until hypertension has reached a severe or life-threatening stage. There are two main types of hypertension: primary, essential hypertension, and secondary hypertension. Primary hypertension develops over many years and is often due to a combination of genetic and lifestyle factors. Secondary hypertension, on the other hand, is caused by an underlying condition such as kidney disease, adrenal gland tumors, or certain medications. Several risk factors can increase your chances of developing hypertension. These include age, family history, being overweight or obese, lack of physical activity, tobacco use, high sodium diet, low potassium intake, excessive alcohol consumption, and stress. Chronic conditions like diabetes and kidney disease also play a role. Diagnosis of hypertension is straightforward and typically involves measuring your blood pressure using a cuff. A reading of 130/80ths mmHg or higher is generally considered hypertensive. Multiple readings over time are necessary to confirm the diagnosis. Hypertension can lead to various complications if left untreated, such as heart disease, stroke, kidney damage, and vision loss. That's why early detection and management are crucial. Treatment options for hypertension include lifestyle changes and medications. Adopting a healthier diet, regular physical activity, limiting alcohol intake, quitting smoking, and managing stress can significantly lower your blood pressure. Medications such as diuretics, AC inhibitors, and beta blockers may also be prescribed by your doctor to help control your hypertension. Prevention is always better than cure. By maintaining a healthy lifestyle, you can reduce your risk of developing hypertension. Regular checkups with your healthcare provider can also help catch any early signs of high blood pressure, allowing for timely intervention. Nursing management for hypertension involves regular monitoring of blood pressure, educating patients about lifestyle changes, and ensuring medication adherence. Nurses play a crucial role in helping patients understand their condition, manage their symptoms, and make necessary adjustments to their daily routines. Through consistent support and guidance, nurses can significantly contribute to better health outcomes for individuals with hypertension. Hypertension, or high blood pressure, is another common health issue. Hypertension or low blood pressure can cause dizziness and fainting. Constipation is a condition where you have difficulty passing stools. Diarrhea is the opposite, where you have loose or watery stools. There are several causes of hypertension. These can include dehydration, heart problems, endocrine issues, severe infection, blood loss, and certain medications. Sometimes it can be caused by standing up too quickly, leading to a sudden drop in blood pressure, known as orthostatic hypertension. The signs and symptoms of hypertension can vary. Common symptoms include dizziness, fainting, blurred vision, nausea, fatigue, and lack of concentration. In severe cases, it can lead to shock, which is a medical emergency. Hypertension can be categorized into several types, such as orthostatic hypertension, postprandial hypertension, and neurally mediated hypertension. Each type has distinct triggers and characteristics. Various risk factors can increase the likelihood of developing hypertension. These include age, certain medical conditions, and medications. For example, older adults are more prone to orthostatic hypertension, while individuals with Parkinson's disease might experience neurally mediated hypertension. Diagnosing hypertension typically involves measuring blood pressure, reviewing medical history, and sometimes conducting additional tests to pinpoint the underlying cause. If left untreated, hypertension can lead to complications such as falls, cardiovascular issues, and shock. Therefore, understanding the condition and seeking appropriate medical advice is crucial. Treatment for hypertension often depends on the underlying cause. It may involve lifestyle changes, such as increasing fluid and salt intake, wearing compression stockings and medications to raise blood pressure. Preventing hypertension involves managing risk factors and maintaining a healthy lifestyle. Regular checkups with your healthcare provider can help monitor your blood pressure and catch any early signs of hypertension. Nursing management for hypertension involves regular monitoring of blood pressure, educating patients on lifestyle changes, and assisting with medication management. Nurses play a crucial role in ensuring patients adhere. In our exploration of common health issues, it's crucial to understand cough and dyspnea, which are prevalent symptoms that can affect anyone. A cough is a reflex action to clear your airways of mucus and irritants, while dyspnea, or shortness of breath, is a subjective feeling of not being able to get enough air. The causes of cough can range from common colds and flu, allergies, asthma, and chronic obstructive pulmonary disease, COPD, to more serious conditions like pneumonia or lung cancer. Dyspnea, on the other hand, can be caused by heart conditions, lung diseases, anemia, or even anxiety and panic attacks. Signs and symptoms associated with cough include a sore throat, hoarseness, and sometimes chest pain. Dyspnea symptoms might include rapid breathing, wheezing, and a feeling of tightness in the chest. If left untreated, chronic cough can lead to complications such as sleep disruption, headaches, and in severe cases, rib fractures. Dyspnea can result in decreased quality of life and can be a sign of worsening of an underlying condition. Diagnosing the cause of a cough often involves a physical examination, reviewing medical history, and sometimes additional tests like chest X-rays or lung function tests. For dyspnea, diagnosis may include blood tests, imaging studies, and cardiopulmonary exercise testing. Treatment for cough depends on the underlying cause and may involve medications like antihistamines, decongestants, or antibiotics. For dyspnea, treatment can range from inhalers and oxygen therapy to treating the underlying heart or lung conditions. Preventing cough and dyspnea involves managing risk factors and maintaining a healthy lifestyle. This can include avoiding smoking, staying hydrated, practicing good hand hygiene, and following a balanced diet. Regular checkups with your healthcare provider can help monitor your respiratory health and catch any early signs of issues. Nursing management for cough and dyspnea involves monitoring the patient's respiratory status, administering prescribed medications, and providing education on breathing techniques and lifestyle modifications. Nurses play a crucial role in supporting patients through their recovery and ensuring they adhere to their treatment plans. Gap 2S. Now let's explore another common gastrointestinal issue: diarrhea. Diarrhea is characterized by loose, watery stools and an increased frequency of bowel movements. It can be an acute condition, lasting for a few days, or a chronic issue, persisting for weeks. The causes of diarrhea are varied. They can include infections from viruses, bacteria, or parasites, certain medications, food intolerances, and underlying health conditions like irritable bowel syndrome or Crohn's disease. Signs and symptoms of diarrhea include frequent loose stools, abdominal cramps, bloating, and sometimes nausea and vomiting. Dehydration is a significant concern, especially in severe cases. Diarrhea can be classified into different types, such as osmotic, secretory, and exudative diarrhea. Each type has distinct causes and characteristics. Certain risk factors can increase the likelihood of developing diarrhea. These include traveling to areas with poor sanitation, consuming contaminated food or water, and having a weakened immune system. Diagnosing diarrhea typically involves a review of medical history, a physical examination, and sometimes laboratory tests to identify the cause. If left untreated, diarrhea can lead to complications such as dehydration, electrolyte imbalances, and in severe cases, organ damage. Treatment for diarrhea often involves rehydration, dietary adjustments, and in some cases, medications to address the underlying cause. Preventing diarrhea involves practicing good hygiene, ensuring safe food and water consumption, and staying up to date with vaccinations. Nursing management for diarrhea focuses on monitoring fluid and electrolyte balance, providing patient education on dietary modifications, and ensuring proper hygiene practices to prevent the spread of infection. Now let's discuss another common gastrointestinal issue: constipation. Constipation is characterized by infrequent bowel movements, difficulty passing stools, or a feeling of incomplete evacuation. It is a condition that affects people of all ages and can be both acute and chronic. There are several causes of constipation. These include a low-fiber diet, inadequate fluid intake, lack of physical activity, certain medications, and underlying health conditions such as irritable bowel syndrome or hypothyroidism. Psychological factors like stress and anxiety can also contribute. The signs and symptoms of constipation include having fewer than 3 bowel movements per week, hard or lumpy stools, straining during bowel movements, and a sensation of blockage in the rectum. In some cases, individuals may also experience abdominal pain and bloating. If left untreated, constipation can lead to complications. These include hemorrhoids, anal fissures, fecal impaction, and rectal prolapse. Chronic constipation can also impact quality of life and psychological well-being. Constipation can be classified into primary and secondary types. Primary constipation is further divided into normal transit, slow transit, and pelvic floor dysfunction. Secondary constipation is usually a result of another medical condition or medication. Treatment for constipation often involves lifestyle changes, increasing dietary fiber intake, drinking plenty of fluids, and engaging in regular physical activity can help. Over-the-counter laxatives may be recommended for short-term relief, but it's important to use them cautiously. In some cases, prescription medications or other medical treatments may be necessary. Preventing constipation involves maintaining a healthy diet rich in fiber, staying hydrated, exercising regularly, and establishing a consistent bathroom routine. It's also important to address any underlying health conditions and to manage stress effectively. With a better understanding of constipation, we have now covered several common gastrointestinal issues. Remember, maintaining a balanced diet, staying hydrated, and leading an active lifestyle are key to promoting digestive health. Nursing management for constipation involves patient education on lifestyle modifications, monitoring bowel patterns, and providing support for dietary and fluid intake. Nurses can also guide patients in establishing a regular bowel routine and encourage physical activity to promote bowel movements. Additionally, they can assist in the appropriate use of laxatives and other medications, ensuring patients understand their proper use and potential side effects. Now, let's delve into another common health issue: headaches. Headaches are a common condition that involves pain in the head, scalp, or neck. They can vary in intensity, duration, and location, affecting people of all ages. There are numerous causes of headaches. These can include stress, dehydration, poor posture, eye strain, certain foods and drinks, and lack of sleep. More severe headaches may result from underlying health conditions such as migraines, tension-type headaches, or cluster headaches. The signs and symptoms of headaches can vary widely. Common symptoms include a dull, aching pain, pressure or tightness across the forehead or on the sides and back of the head, and sensitivity to light and sound. In the case of migraines, individuals may experience throbbing pain, nausea, vomiting, and visual disturbances known as auras. Several risk factors can increase the likelihood of experiencing headaches. These include genetics, age, gender, and lifestyle factors such as stress and diet. Women are more likely to suffer from migraines, possibly due to hormonal changes. Headaches are classified into primary and secondary types. Primary headaches include migraines, tension-type headaches, and cluster headaches. Secondary headaches are a result of another medical condition, such as sinus infections, head injuries, or high blood pressure. If left untreated, headaches can lead to complications. These may include chronic daily headaches, medication overuse headaches, and decreased quality of life. Chronic headaches can also impact mental health, leading to anxiety and depression. Treatment for headaches often depends on the underlying cause. Over-the-counter pain relievers such as ibuprofen or acetaminophen can be effective for mild headaches. For migraines, prescription medications and lifestyle changes may be necessary. In some cases, non-pharmacological treatments such as acupuncture, physical therapy, and stress management techniques can also provide relief. Preventing headaches involves identifying and avoiding triggers. Maintaining a healthy lifestyle, staying hydrated, practicing good posture, getting regular exercise, and ensuring adequate sleep are key preventive measures. It's also important to manage stress and to seek medical advice if headaches become frequent or severe. With this comprehensive understanding of headaches, we have now covered another significant health issue. Remember, adopting a healthy lifestyle and addressing potential triggers can greatly reduce the frequency and severity of headaches, and I hope you enjoyed the video. Subscribe for more interesting topics about our body.